So PAO surgery is short for periacetabular osteotomy, and it's an operation which we use to change the position of a patient's hip socket. So often in individuals with hip dysplasia, we can improve their symptoms by moving the hip socket to a better, more biomechanical advantaged position, which often will improve patients' symptoms and allow them to get back to their desired activities. So the most common reason for doing PAO surgery is for individuals with hip dysplasia. It's usually performed in younger patients under the age of 40 or 45, and occasionally we do it for other reasons, such as the hip socket, which is pointing too far backwards. But the general reason is for the management of symptomatic hip dysplasia or a shallow hip socket. So PAO surgery can very significantly improve patients' pain, with that their mobility and their quality of life. And we also hope it will reduce the need for patients to have further hip surgery in the form of a hip replacement. It can, we believe, slow the progression of arthritis in a hip which is shallow by making it more normally positioned. So a PAO is a big operation, there's no escaping that. The techniques have significantly improved over the last 15 to 20 years. It can now be done through a small single incision in the groin, which is well hidden within the bikini line. The incision can be as small as 10 to 15 centimeters. The procedure only takes an hour and a half to 2 hours, though there is some blood loss expected during the operation. Patients do recover very quickly now after this type of surgery, and we aim to get them up on crutches within the first 24 hours, and then to be mobilizing short distances shortly thereafter. The recovery period is a little bit longer than other types of hip surgery, as we need to protect the bones as they heal. So most patients are on crutches for up to 3 months afterwards. The initial recovery after surgery takes 3 or 4 days. That's usually the period of time that patients are in hospital after this type of surgery. Following that, we are on crutches, putting only a little bit of weight through the operated leg for the first 6 weeks, and then building up that weight bearing to 3 months after surgery. It does, however, take up to 4 or 5 months to fully recover after the surgery. So PAO surgery is generally considered very successful, especially for hip dysplasia. A large proportion of patients having this operation will see significant improvements in their pain, their quality of life, and their mobility. We also hope that over time it will reduce their development of osteoarthritis, and with it the need for hip replacement surgery.